Welcome back, superhumans. We are having an episode where it's just the two of us, your two fertility sisters, talking about a topic that matters to you. Today, we're going to talk about fresh embryo transfers, of course, a key step in many fertility journeys. We are here to give you the ins and outs of fresh embryo transfer, how they work, and what you can expect.
Yes. So we're going to be covering the science. We're going to be covering timelines, the pros, the cons, and the challenges that come with fresh embryo transfers. And of course, most importantly, we're going to make sure that it's all understandable without the medical jargon. Now, if you are interested in hearing more about frozen embryo transfers, stay tuned. There is a fair amount of overlap between fresh embryo transfers and frozen embryo transfers, but we're going to record them as separate episodes because we really want them to be standalone series of episodes for each topic. So, frozen embryo transfer is coming. Do not worry.
All right, so let's start at the beginning. If you're doing IVF, which of course, as you know, stands for in vitro fertilization, we know that it involves stimulating your ovaries with medications to produce multiple eggs. We then retrieve those eggs and fertilize them in the lab with either your partner sperm or donor sperm. And if you need to go back to the original IVF episodes where we break this down, those episodes will be 14, 20, 54, and 58.
Once the eggs are fertilized, they start growing into embryos in the lab. And this is where a fresh embryo transfer may come into play, meaning putting an embryo into the uterus just a few days after retrieval versus freezing them and potentially transferring them later on in time.
So, as the name would suggest, in a fresh embryo transfer, the embryo is transferred to the uterus usually day 3 or day 5 after the egg retrieval. This embryo never gets to be frozen, which can be appealing to some patients because it allows the patients to have an embryo transfer more quickly than they would if they were doing a frozen embryo transfer. Now, this doesn't mean that fresh embryo transfers don't have a role in your fertility journey. In the old days, like when I started practicing fertility care, fresh embryo transfers were the default because our freezing protocols didn't have very good success rates. But now, with the use of vitrification, which is a method of freezing embryos, pregnancy rates with frozen embryo transfers are very good. So, like at Markham Fertility Center, there are many, many fertility clinics that actually do more frozen embryo transfers than fresh embryo transfers.
First, we're going to talk about the difference between fresh and frozen embryo transfers. In a frozen embryo transfer, often referred to as an FET, we freeze the embryos and we transfer them in a future cycle. Again, with a fresh transfer, we go straight from retrieval to transfer in the same cycle. Fresh transfers can be a good option when a patient is young, healthy, and has responded well to stimulation, but without signs of overstimulation. So, as your fertility physicians, we're going to be looking at your hormone levels. We're going to be looking at how your lining looks on ultrasound and if everything is well aligned. IVF stimulation feels a little bit like the story of Goldilocks. We want to stimulate enough to get a good number of eggs because we know that that leads to better outcomes. More eggs can equal more embryos, can equal a better chance of having a good embryo and therefore a higher pregnancy rate. But we don't want to stimulate so aggressively that someone is at risk of OHSS, which is ovarian hyperstimulation syndrome, or poor egg quality.
Yes, ovarian hyperstimulation syndrome can happen when the ovaries over-respond to fertility medications during the process of stimulating egg production. It can cause the ovaries to become very swollen and painful, and in some cases can lead to severe bloating, nausea, or fluid retention in the abdomen. Most cases are mild, they get better on their own, but severe cases may require medical care. So, in a situation where we think there is a risk of ovarian hyperstimulation syndrome, or where the estrogen level has gone too high, we would avoid a fresh transfer to, again, protect this patient from developing worsening ovarian hyperstimulation syndrome. In these cases, freezing all the embryos until the body has had a time to recover from the stimulation and return back to a more natural state would be advisable.
Another example where we may think about freezing embryos and not doing a fresh transfer is if we're doing genetic testing or pre implantation genetic testing on embryos. So, to be able to do pre implantation genetic testing, we have the embryos in the lab. And once they reach the blastocyst stage, the lab will do a biopsy of the trophectoderm of the embryo and send off about 4 to 6 cells to the company that does the testing. Now, these genetic testing results take about 2 weeks to come back. So, we need to freeze the embryos in the meanwhile. We go into a lot more detail about pre implantation genetic testing, especially for aneuploidy in episode 30, and pre implantation genetic testing for a monogenic disorder in episode 36. But again, that is a very important reason, a very common reason, I would say, of why we end up doing frozen embryo transfers.
Another reason worth mentioning as to why we may recommend a frozen embryo transfer is if there is any concern with the lining of the uterus or with the cavity of the uterus itself. So, very often we would do a sonohistogram prior to doing an IVF cycle, but sometimes a new polyp can grow. Maybe there could be a scar tissue that wasn't noted before, or maybe the lining doesn't get to the thickness levels that we want. And in a situation like this, it would be advisable to still retrieve the eggs, make the embryos, freeze them, ideally doing genetic testing if possible, and then doing an embryo transfer once we've had a chance to really assess the uterine cavity and maximize it. And if you want to hear more about polyps and fibroids, you should go back and listen to episode 28 where we cover this topic.
Now, this is a situation that can come up sometimes, so I think it's worth addressing. Sometimes your sonohistogram that you've done relatively recently may look perfect, but we end up doing a lot of ultrasounds during cycle monitoring for the IVF cycle itself, and it may suggest that there might be something in the uterus. So, your physician may recommend repeating the sono prior to putting an embryo in because at the end of the day, these embryos are super precious. So, if there's any question that there might be something going on in the uterus, we always want to take a pause, consider whether there may be something there, what the potential effect could be, and to have a discussion about the pros and cons of proceeding with the fresh transfer versus freezing the embryos and doing a repeat sonohistogram to really be more sure and to have more confidence when you're going into a transfer.
Another consideration for a fresh embryo transfer is cost. At Markham Fertility Center, a fresh embryo transfer is included in the cycle fee for IVF. So there is no extra cost for a patient doing a fresh embryo transfer when they're going through an IVF cycle. Now, a frozen embryo transfer is a completely different cycle that requires its own consultation, its own investigation, its own setup and monitoring, and therefore it's a separate fee. Now, this isn't the case in every clinic. Some clinics do charge extra for a fresh embryo transfer. So make sure that you ask your care team. But at least at Market Fertility Center, saving money could be one of the reasons that we're discussing a fresh embryo transfer. Because if you only have one embryo and it is transferred fresh, then that avoids the cost of setting up a frozen embryo transfer later.
As Dr. Garcia mentioned earlier, the freezing of embryos these days is considered extremely safe, and over 95% of embryos are successfully thawed. There is no evidence to suggest that the freezing and thawing of embryos somehow degrades the quality of the embryo in any way, especially when you're starting with a good quality embryo. That being said, it's important to keep in mind that not all embryos are, quote unquote, freezable quality, especially on day 5 post retrieval. A fresh transfer, which we'll talk about, must happen 5 days post retrieval because that's when the uterus is actually synchronized with the embryo. So, if we do a fresh transfer on that day 5 post retrieval, we have to accept that we simply don't know sometimes if the embryo will become a good quality blast in some situations. Because we know that a blastocyst arising on day 5 or day 6 or day 7 can lead to a pregnancy. Now, we have a much lower threshold in regards to embryo quality for fresh transfer versus freezing. What that means is that we need that embryo to get to the blastocyst stage to be able to freeze it. If it's not a blastocyst yet, we are able to proceed with a fresh embryo transfer. So, there may be some situations when patients have done previous IVF cycles where they may not have made quote unquote freezable or quote unquote biopsyable blastocysts. We may suggest a fresh transfer, again, assuming that they're a good candidate for the other reasons we talked about, really for the sake of trying a transfer, because we know that at the end of the day, the embryo has to succeed in the uterine lining.
Now, let's talk about the timeline for what a typical fresh embryo transfer looks like. First, we start with the day of the egg retrieval. This is the day in which we collect the eggs at Markham Fertility Center. We do it under anesthesia with our amazing anesthesiology partners that come to give you those miraculous medications that put you to sleep and make sure that you don't feel pain. The eggs that are retrieved and they're fertilized in the lab on the same day. And over the next 5 days, we watch the embryos grow. If everything looks good and there were no issues with the lining and your doctor approved for a fresh embryo transfer, then you'll come back to do that fresh embryo transfer 5 days after retrieval. Now, a common question that gets asked is what about a day 3 embryo transfer versus a day 5 fresh embryo transfer? What are the differences there and what makes us decide one versus the other?
Years ago, day 3 fresh transfers were the norm. Since about the early to mid 2000s, day 5 fresh transfers have really become standard practice, certainly in Canada. I would say that of all the fresh embryo transfers we do at Markham Fertility Center, about 98% of them are going to be day 5 transfers. The reason for this big shift is because day 5 transfers are associated with higher chance of implantation, improved ability to select a good embryo, and a reduction in the number of embryos we're actually transferring at a time, which again helps lower the risk of multiple gestation like twins or triplets. This extended culture to day 5 allows for better selection of embryos that have a higher potential for development, as we know that embryos that are reaching the blastocyst stage are more likely to be viable and therefore increase the likelihood of that successful implantation and a live birth for transfer. In any IVF cycle, not every embryo from day 3 is going to continue to grow to blastocyst. When somebody has many embryos that are growing on day 3, delaying that transfer to day 5 gives us a lot more info about the embryo and helps us figure out which one has the best potential of success.
The benefit of growing to day 5 is exactly what Dr. Weiss said, is the ability to pick the embryo that has the highest potential of developing into a baby. Now, sometimes embryos just don't grow. So either they fertilize and when you see them on day 3 and then you see them on day 5 and you see that there is no development from fertilization to day 3 to day 5. And this could be really frustrating, very disappointing, and very difficult for both patients and physicians to deal with. The reasons why this happen are complex. Sometimes it's related to the quality of the eggs. There have been some studies also suggesting that it might be related to the quality of the sperm, and that sometimes sperm with high degrees of DNA fragmentation may cause a delay in embryo development. We don't usually have a really good explanation as to why this happened. It's generally related to the quality of the eggs and the sperm that were used in that particular cycle. And we can certainly do a whole episode about fertilization failure or blastocyst development failure and go into more details. Now, I wanted to add that another reason why there was a big shift to day 5 embryo transfers is that it's actually associated with a lower risk of ectopic pregnancy compared to day 3 embryo transfers. And if you want to understand more about what an ectopic pregnancy is, you should go back and listen to episode 59, where we covered that topic. So, to illustrate the point, I want to tell you about a meta analysis. Remember, a meta analysis is a combination of multiple studies. This particular meta analysis included 22 different studies that looked at 143,000 pregnancies. And they noticed that there was a lower ectopic pregnancy rate in women that did day 5 embryo transfers compared to those that were doing a day 3 embryo transfer.
Let's talk about the transfer itself. How does it work? What's it like? And of course, the most common question we get, what can I do to maximize my chance of success?
Well, if you made it to the embryo transfer day, it is a big milestone. It is completely normal to feel a mix of excitement, nerves, and of course, anxiety, because anxiety is everywhere on the fertility journey, as we all know. So let's talk about those steps so that you can feel calm and prepared.
At Market Fertility Center, when we are scheduling your fresh embryo transfer, you're going to receive instructions on the patient portal before your transfer. They're all going to be written out for you to have a look at, but there are a few important things that I wanted to highlight. Number one, please come in with a comfortably full bladder. That means you don't have to be bursting. You don't have to be doing the pee dance in the waiting room, but we want the bladder to be full. So you feel like, I could go to the bathroom right now, but I don't have to run to the bathroom right now, is the best way I could describe it, I suppose. Having a full bladder allows us to get the best possible view of your uterus and the lining while we're doing the ultrasound. Now, we usually recommend drinking about 1 liter of water about an hour before your embryo transfer appointment. But this is general advice. Listen to your body. If you're too full and you're feeling uncomfortable or you're cramping, it's totally okay to use the washroom and release a little bit of urine. Also, another really, really important point is that if you want to do a fresh embryo transfer, you absolutely must start progesterone supplementation the day of the retrieval. This is why we're so adamant about having a plan to do a fresh embryo transfer on the day of the retrieval. Unfortunately, we can't make a change or change the plan a few days after retrieval because you're probably not on the progesterone at that point, and we know that that's going to negatively affect the chance of success. So, this is why on the day of the retrieval, we are really trying to nail down to figure out if we're doing a fresh embryo transfer or not.
On the day of your embryo transfer, or actually any time that you come to the fertility clinic, please avoid wearing strong scents like perfumes or lotions. Embryos can be very sensitive to smells. This applies to both patients and partners. And it's not only for embryos, but it's also there could be other staff that have allergies, or there could be other patients that are very sensitive as well. And at Market Fertility Center, we do have an scent free environment, and that is to make sure that all of our patients are comfortable and feel safe in the space.
On the day of your fresh transfer, when you arrive at the clinic, you're going to check in with our front desk concierge. Please don't forget to bring ID. We need to confirm your identity because we want to make sure that we're putting the right embryo in the right person. After you check in, you're going to wait in our lounge. Quick tip, skip the coffee that morning because caffeine can really irritate your bladder and make you even more uncomfortable. Now, the doctor who's going to be performing the transfer will come get you from this waiting area and go over the day's plan. They're going to confirm your identification again and review details about the embryo or embryos that we're transferring. This is a big moment because the lab is not going to be giving you a call on the day of the transfer. The doctor's going to fill you in on all of the day 5 embryology details. Now, again, your partner or support person is welcome to be with you throughout this entire process.
The transfer takes place in the procedure room, which is the same space where the egg retrieval happened. You're going to change into a gown. You just need to remove your bottoms, like pants and underwear. You can still keep your socks and slippers. You're going to lie back on the exam table, similar to what you would experience when, for example, you're doing a sonohistogram or a pap test. Your support person is more than welcome to stay in the room with you. And the transfer team includes the fertility specialist, the ultrasound technician, and the embryologist who are going to be passing on the embryo through the little window on the side. And before we do the embryo transfer, we're going to do another identity check for safety.
The ultrasound tech is going to be performing an abdominal ultrasound. This means that they're going to be taking the ultrasound probe and it's going to be on top of your belly. And this is going to help the doctor see your uterus clearly. The doctor is going to insert a speculum into the vagina, just like during a pap test or an IUI, for instance. and they're going to clean the cervix. Then they're going to gently pass a soft, thin catheter through the cervix. Now, again, very important to point out that this is very different from a sonohistogram. Most patients who go through an embryo transfer say that it feels like a pap test, but like with a full bladder. It is not going to be crampy in the same way that a sono was, but you may have, again, some increased pressure from the full bladder. Some patients have an uncomfortable experience with a sonohistogram, and the transfer is not the same.
Now, once the catheter is in place, the physician will communicate to the embryologist that the embryo can now be passed to the doctor. At this point, the embryologist is going to take the embryo from the incubator and load it into the catheter, do one last ID confirmation, and pass the catheter with the embryo loading into the doctor so that the doctor can then transfer that embryo very carefully into the uterus. The process is typically painless and no sedation or recovery time is needed at this point. The whole procedure takes only about 5 to 10 minutes.
Now, you may even see the embryo being placed in the lining on the ultrasound screen. Very often, it looks like a tiny flash of light. And to be honest, it's one of our favorite parts of the day. I always think that it looks a little bit like a shooting star. After the transfer, we're going to pass that catheter back to the embryologist who checks to make sure that the embryo has actually left the catheter and didn't get stuck to the wall of the catheter. On ultrasound, we're not seeing the embryo itself. Remember, the embryo is microscopic. We're just seeing little air bubbles that the embryologist will place on either side of the embryo to allow us to see it. Embryos can get stuck to the wall of the catheter about 2% of the time. And if that happens, we simply repeat the process with the same embryo. If all looks good, then we remove the speculum and we'll have the patient lie down, rest for 5 minutes. Then you can get dressed and finally fully empty your bladder. Many patients say that it's like the best pee of their life. And no, you absolutely cannot pee the embryo out.
Exactly. Now, once you're feeling ready, the nurses will go over the instructions one more time before you head home. Most people return to regular activities the same day. Like a strict bed rest, it's not necessary. I would just say take it easy and be kind to yourself. We would schedule a blood pregnancy test, which is an ACG level, about 2 weeks after the embryo transfer. The embryo transfer day is one of the most meaningful moments in the IVF journey. It is okay to feel emotional. It just means that it really matters. To be honest, I could sit here and talk about what it feels as a fertility specialist to do an embryo transfer. And I think it's incredible and magical. And I have my own little routine that I do prior to doing an embryo transfer because I really like getting into that mind space, into the magic of what is about to happen. But I don't want you to hear from me. I want you to go back to episode 41 and listen to Hannah, who talked about her experience in her fertility journey. And she specifically talked about what it's like being in the embryo transfer room and having an embryo transfer.
Now, another time where we've talked about embryo transfers was episode 39, where you and I reviewed the movie Joy. Joy is an absolutely incredible movie. And if you have not seen it, you should go to Netflix right away and watch it because they did such a phenomenal job at portraying the embryo transfer moment, the emotional weight of the moment, all the feelings in that scene in that movie. And again, you can listen to episode 39 where we talk about the whole movie. But Joy, incredible movie. Everybody should see it.
So, in this episode, we spend most of our time talking about fresh embryo transfer. We cover things like day 3 versus day 5 embryo transfer. We talked about the timelines for a fresh embryo transfer. We talked about some of the reasons that your doctor may suggest doing a frozen embryo transfer versus a fresh embryo transfer, and some of the financial impacts of doing a fresh versus a frozen embryo transfer.
We're going to be doing a part 2 where we're going to be talking even more about fresh embryo transfers. In an upcoming episode, we're going to be discussing some frequently asked questions that we get from our patients. about fresh embryo transfers. And we're going to be talking about why progesterone is so important and why we use specific types of progesterone over another. We're also going to be talking about the success rates and outcomes, what we can expect in a fresh embryo transfer. And again, we're going to talk more about the pros and cons of fresh versus frozen embryo transfers and some of the evidence and literature behind that. And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss.
Music from Mixkit, Life is a Dream by Michael Ramir C.
My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.